All right, welcome back, everybody. According to the World Health Organization, as of November the 7th, Ebola has claimed 4,959 lives in countries in West Africa. Ebola is one of the world's most deadly diseases. It can kill up to 90% of the people who contract it, and patients need to be treated in isolation. Now, Doctors Without Borders, also known as Médecins Sans Frontières West Africa Ebola Response, has been in place since March and counts activities in Guinea, Liberia, Mali and Sierra Leone. They have sent out a call for assistance, and from their Johannesburg office we're joined by Buri Lagrange, who's in studio with us. Good to have you. Welcome to the program.
Morning, thanks for having us.
Obviously, Doctors Without Borders has been working in West Africa. What is the situation like?
So today we're seeing a slight slowdown in the number of infections that are reported to our facilities in Liberia, but it's no real. We shouldn't rest on our laurels. What we are seeing is quite a dire situation still in Sierra Leone and also in Guinea. And so what we're calling on states to do is to still continue their expansion of their activities in these countries to build capacity for response. These are isolation centres, but it's important not only to have the centres present, but also to have competent staff that are trained and are following protocols properly to treat and isolate these cases.
Yeah. So, I mean, the fact that there are fewer infections now, is this an indication that headway is being made?
For us, what it shows is that the epidemic's quite unpredictable. So in Guinea, for instance, last month, in October, there were significantly more, 23% more infections reported at our isolation facilities. We run 6 treatment and isolation facilities in Guinea, Sierra Leone and also Liberia, where we've got a capacity of 600 beds. But we know that our capacity is limited, and so it's encouraging to see states like Cuba, the US, the UK bringing manpower to bear on the epidemic. But it's far from enough. We still see critical gaps in terms of offering medical care, linking people in communities to care. So ambulance services are not running efficiently. And we know in Sierra Leone, for instance, where 85% of the calls that come through a call centre aren't really answered. So as you can see, we're already 6 months into this epidemic. Yeah. But the very basic measures, basic elements of our health system are just not functioning properly. And this hampers progress.
All right. How many South African doctors are actually working in these areas?
So to date, we've sent 23 Southern African staff to work in our projects in Liberia, Sierra Leone and also Guinea. And currently there are 7 South African staff working in the field right now. Yeah. 2 of those are doctors that have returned for a second assignment just because they feel compelled to return because of what they've seen, and they know that the difference that they can make on the ground today is a personal quest for them, not just something that they expect the international community as such to deal with.
What have they seen? I mean, when they come back and the stories that they tell you, you know, we read about it in the news, we hear about it all the time. There's a lot of fear out there, but you know, when you are there, you're dealing with it hands-on. What is it really like?
So one of the doctors, Dr. Julius Vitala, that returned in October for a short 21-day break, which is part of our protocol. So she told us of the dire situation just in the healthcare centre where she worked, where essentially, because the Ebola epidemic is so visible, it's such a great concern, many people are afraid to come to facilities for fear of getting infected with Ebola. So if you have malaria, for instance, or if you're an expectant mother, and you're struggling with complications of your birth, you may not make it to the hospital, and as a consequence you may die of a non-Ebola related condition, and that might take your life as opposed to Ebola. And so we know that the health systems, and in particular from her perspective, the health systems are paralysed and are not working efficiently. So there's sort of a second emergency that's emerging from the Ebola epidemic.
Yeah. What about the risk of the doctors actually contracting it? Because we've heard of a few cases around the world where doctors have contracted it and they've actually died. Medicine or Doctors Without Borders, any cases firstly, and secondly, any fears of leaving the patients and saying, well, look, I have to look after myself?
Well, for our staff, the patients are the most important. And we know currently we're sitting at about 23 staff that have been infected since the start of the epidemic. Of these, limited number have sadly passed away. We've had really great news that Dr. Craig Spencer, a US citizen that's worked with us in Guinea, has made a full recovery And so far, none of our international staff have succumbed to infections. But we also find that it's really difficult for our Liberian, Guinean, and Sierra Leonean staff, because they have to go back home where potentially it's really difficult to ensure an absolutely watertight situation where you're not exposing yourself to risk of infection. So at work, people are very vigilant, but it's when they go home that they're at risk.
Yeah. How can South Africans help?
So we're calling on South Africans to make a contribution to our activities related to Ebola, but also other emergency activities. And the easiest way to get involved with us is to SMS the word JOIN, that's JOIN, to 41486. And that gives us an immediate donation of 15 Rand a month. Alternatively, people can also visit www.decidetodonate.co.za, where they can make an online donation.
Okay. So if we do SMS this, is it a one-off 15 Rand, or does it debit your account every month?
It's a monthly debit, but there is an opt-out option. But we find that many people choose this option because it's such a small amount, and they still feel they're contributing to worthwhile work that saves lives on the ground.
Okay, brilliant. Well, there you go. Those are the details. I know many people ask the question, how can we help? Well, we're giving you an easy way to help with the situation. 15 Rand a month, SMS JOIN to 41486. And you can help with just that 15 Rand a month. Thank you for joining us, and just keep up the great work that you guys are doing. Burry Lachranj is a communications from Doctors Without Borders, who are working tirelessly in West Africa to try and alleviate the situation of Ebola. Let's take a break.